With health facilities are under immense pressure given the impact of the third wave, which is having on Gauteng in particular. Over 3,000 new cases reported in the last 24 hours. Close to 90 people have succumbed to the virus in that same period. There's also, of course, a delay on the release of some 2 million Johnson & Johnson vaccine doses due to that mix-up at the Baltimore factory in the USA. The Health Department's Deputy Director General, Dr. Nicholas Crisp, joins us now. Dr. Crisp, thank you so much for your time this evening. I do have to ask you about the news of the day, and that is that the Health Minister is now on special leave, the President making that decision earlier this afternoon. How does it impact the running of the department?
Good evening, Sally, and good evening to the viewers. Well, as officials, I think we have our jobs to do, and we get on and we do them. I'm sure we'll miss the Minister because he provides a lot of leadership to us. But we all work with our Director General, and we will work with Minister Ngubane, and we work well with the Deputy Minister, and we have a job to do.
How concerned are you that other members of the department might be implicated in this Digital Vibes scandal?
Well, I think that it happens, and there will always be allegations, but until those allegations are dealt with, as the President has already explained and as our DG has explained as far as the administration is concerned, there are processes, and until we get the outcomes of those reports, we'll just carry on and doing our work, and the people are all at work doing what they are paid to do.
Let's talk about the vaccine rollout. How many vaccines have you got left to administer currently?
So, Sally, at the moment we have a constant flow of Pfizer vaccines. As you know, that's a 2-dose vaccine, and in the order of 650,000 more or less coming on a weekly basis. So for now, that is our constraint, and that's the capacity we're able to deal with. So it's moving down the supply chain at a constant stream where we are able to manage around 70,000 vaccinations a day to keep the constant stream. Of course, we missed the fact that we should have already had a considerable number of Johnson & Johnson vaccines in our program, which would have enabled us to step up to over double what we are doing now. But that has not come to pass, and we are hoping to get a positive outcome for all or some of the vaccines that are still held and unable to be released until the FDA has given approval.
How many vaccines were administered on Monday?
Yeah, and I asked me, I don't have the figure open in front of me, but we are around 70,000, between 70 and 75,000 a day on weekdays at the moment.
Why are the weekends so slow? I mean, surely we need to be gunning it 7 days a week.
Well, a number of reasons. One is, and I've said this before and I'll say it again, those of us in the centre have to appreciate that staff on the periphery also need a break. And it's been a trying time for health personnel across the country, public and private. They've been extremely hard pressed, and it's been difficult not just because of the long hours they've had to work, but because they've seen colleagues and friends and patients sick and dying. And I think we need to recognize that it's important for people to take a break. So that's part of the reason. Another part of the reason is that we don't have unlimited budgets for paying overtime for people to work over weekends. And the third reason, and probably the most important for us at the moment, we just don't have a vaccine pipeline that can sustain more vaccines than we're administering at the moment. So at the moment, we are pretty much operating at capacity with the vaccines moving down the supply chain at a process or at a speed that allows us to keep more or less 10 days worth of vaccines in that supply chain at any one time so that we don't run out along the way.
Can you tell us how many vaccines have been administered in total so far? I know a couple of days ago, I think it was at 1.35 million. Is that where we still are?
So it's just under 1.5 million. We obviously are reporting 1 day behind because we verify the figures at midnight every night before we put them in the public domain. But obviously today's vaccines will only be available after, sometime during the day tomorrow after they've been verified. But we are now approaching the 1.5 million.
Let's talk about that Johnson & Johnson vaccine. You did allude to it earlier, and we know that we're very much waiting for the FDA to give the nod. And I've spoken a number of times to Professor Helen Rees, and we know that SAHPRA is making sort of impassioned pleas for them to just hurry on up because it's having a huge impact on us. Are you concerned by the fact that it's taken over 3 months for the FDA and we still see them delaying every few days when we expect an announcement? Does that suggest to you that we might have to make a different plan?
Well, it's extremely frustrating because of the time it's taken and our inability to plan or to know what to expect next. But, I mean, we work in this environment, so we understand the safety measures that are taken. We understand that what has to happen in a biologicals factory to get good manufacturing practice. And it's been explained to us what has happened with the batch manufacturing. We are not the only ones affected. There are many countries where the vaccine that they are expecting is coming out of the active ingredients is coming out of that same plant. And we can be as frustrated as we want, but we have plans in place. We have had plans in place for a long time. And our provincial colleagues who are responsible for vaccinating and our private sector colleagues who are the providers in the private sector have been champing at the bit to open more sites and to get out with vaccine into the field. The public has pressure on us, but there's nothing we can do about that vaccine.
Yeah.
So when we hear, we will either hear that all or some of those batches which are in the consignments here for us have either been released or have to be destroyed. Then we will know what we're dealing with. Of course, Johnson & Johnson will still have to provide us with the vaccines we've ordered, and hopefully they will have sorted out the good manufacturing practice and be able to get their processes running smoothly so that all their clients can get the vaccine they've paid for or ordered.
There was an original deadline to try and vaccinate all the over 60s who wanted it, and that's a group of at least 5 million by the end of June. I presume that deadline is absolutely not going to be met. Are you revising deadlines? And why have you changed to focus on the over 40s next rather than those with comorbidities?
Okay, so we are at the current tempo. We know that we will vaccinate at least 52% of the target population by the end of June. And that's obviously disappointing to us. We would have preferred it to be 90%. But realistically, if you don't have the vaccine, you're not going to get further than where you can go. But we will reach people, and we know about them. They are registered. We are continuing to register people all the time. And there is still a queue of around about 2 million people waiting for vaccination. So we're not worried. We are just disappointed at the moment that it is going slower than we are capable of doing. As far as the next categories are concerned, there are a whole lot of competing demands. I think everybody is aware that we are under pressure to get children back to school, and we would very much like to vaccinate the education sector employees so that that is a safe environment. We have a whole lot of major economy workplaces where it's risky to put large amounts of people together in mine cages, factory floors, and so on, even in the informal taxi environment. So we are very keen to get workers who work in the economy, who are in risky work environments, to get them vaccinated as well. And then, of course, we would like to vaccinate everybody with comorbidities. But identifying individuals with comorbidities is a far more individually complex and labor-intensive process. And it's open to fraud because we have no way of the clinician at the vaccination point verifying somebody's either medical certificate or their personal statement about their health status. It's also personal information and patient information that is involved, and there are legal risks for us in the way in which we ask for and capture data in such a public environment. So that is why we were advised, and there's a global advisory on this, that if you vaccinate people over the age of 60, you capture a huge portion of those with comorbidities and people at risk because of age. That's not to say people younger than that. Even young people with comorbidities should not be vaccinated, but we are getting there.
All right. Well, thank you very much for the update. We do appreciate it. Not an easy time for the Health Department.